What is idiopathic scoliosis? Scoliosis is the development of an unnatural sideways spinal curvature. A scoliotic curve also rotates or twists, making it a three-dimensional condition. The twist is typically into the concavity of the scoliosis. Scoliosis is also a progressive condition, meaning it's its very nature to worsen over time. There are many different types of scoliosis, but the most common types are something called idiopathic scoliosis. This is the most common type of scoliosis, and it affects all ages. Idiopathic means there's no clearly associated single cause of scoliosis, meaning these are normal, healthy people. For some reason, they're developing a scoliosis. We can't tell you what's causing it, so it means unknown cause. Idiopathic scoliosis is considered to be multifactorial, meaning there's many variables and maybe even a combination of conditions and variables that could be associated for the development of scoliosis from one patient to the other. When we look at idiopathic scoliosis, we can look at many different causation factors. One thing patients like to consider is something called genetics, like your sister has it, maybe your mom has it, and you develop scoliosis. Well, their genetics is a factor. We know it's not a single cause, meaning they've done studies on identical twins, and they've only found about 60% of identical twins to both share scoliosis. 40% don't. Well, how can somebody with the exact same DNA, one develops scoliosis and one doesn't? Because there's another risk variable. There's some kind of epigenetics or some kind of risk factor that's being exposed to one patient and not the other that's causing those genetics of the scoliosis to express themselves. We can look at many variables. In fact, we think there's 50 to 60 variables that could be associated with the causation of scoliosis, and there's probably a lot of variables that we don't even know. But idiopathic scoliosis means we don't know what's causing it. Now, even though if we don't know the cause of scoliosis, is it going to really affect the way we treat scoliosis? And that's really the big question, because when we look at causation, we're wondering, would that mean we can't treat it? Well, to answer this question, we have to know a little bit more about the most common type. So adolescent idiopathic scoliosis is by far the most common type of idiopathic scoliosis diagnosis, meaning this is typically diagnosed between 10 and 18 years of age, and this is because we know patients are growing during this stage, and growth is what normally triggers progression, or at least rapid progression. And as curves progress during their growth phase, this is what tends to happen, and then they get diagnosed. However, some curves don't progress. In fact, the majority of cases do not progress into significant numbers. They can stay 5 or 10 degrees, relatively small, but now they start progressing in the adult form, and when they progress in the adult form, they can cause pain. So patients with their initial diagnosis in the adult form because of pain may still have adolescent idiopathic scoliosis that went undiagnosed, that are now diagnosed in the adult form as a result of pain. So this can also be one main reason that a lot of patients are undiagnosed. And we actually know the patient population as it increases, meaning as you go from like 20 to 30-year-olds, 30 to 40-year-olds, 50 to 60-year-olds, 70 to 80-year-olds, the older the population group, the more percentage of patients that we see with scoliosis, because we know there's other people developing scoliosis, and there's a lot of patients that never actually get diagnosed with scoliosis in younger life. Idiopathic scoliosis accounts for the majority of patients, but we do know the remaining 20% are associated with known causes, and this is neuromuscular scoliosis, degenerative scoliosis, and congenital scoliosis. Neuromuscular scoliosis is when you have a condition that's a larger neuromuscular condition and you develop scoliosis, and normally it's affecting the muscles of the body, the connective tissue of the body, or the neurological system of the body. Degenerative scoliosis occurs when something happens in young adult life that causes the spine to shift in a certain area. This certain area remains out of alignment and goes through an accelerated degenerative phase and starts to degenerate faster in this area relative to the other. And this can lead to a degenerative scoliosis, typically in the lumbar spine. And the last type we'd like to talk about is congenital scoliosis. And this is when you're born with scoliosis. This is when a bone in the spine in utero doesn't develop fully or has a malformed development. And this malformed vertebra or bone will cause a curvature to a type. Now, when we look at the type and the cause of factor, can this really affect how we treat scoliosis? So this is what I was alluding to earlier. When we look at scoliosis and the causes, can it affect how we treat it? Well, yes, in a way, but also no. And the way I like to explain it is that if we don't understand the cause, can we still treat it effectively? And that answer is 100% yes. We can definitely treat scoliosis effectively, even though we don't know what's causing it. And even if we knew the cause, it may not affect how we treat scoliosis, because the majority of the time, by the time we diagnose scoliosis, it's already become structural. It's a structural thing that's already occurring in that person's spine. So let's say, just for theory's sake, let's say the person that developed this scoliosis was a result of some type of nutritional deficiency. And let's just theoretically say it was a vitamin B. This person had a lack of vitamin B and they developed scoliosis. I'm not saying that's what caused it, but I'm just saying for this person. And now the person has a 40-degree curve and they say they're 15 or 16 years old. If you give the person all the vitamin B right now and resupply them, the curve isn't getting straight because now the curve has become structural because they grew with it. The structural component of scoliosis is the underlying problem. So whatever causes it, we believe the body resolves it, but now the curve itself becomes the structural issue, and you must address the structural issue. Another way of explaining it is kind of like an earthquake. We know exactly what causes earthquakes, where plates shift under the earth, causes the ground to rumble, and as a result of it, that rumbling causes buildings to collapse. Well, we could realign the plates. Doesn't mean the buildings are going to be rebuilt. They have to still deal with those collapsed buildings structurally. And that's what I mean about idiopathic scoliosis. That the majority of the time, we don't know what's causing it. But despite the fact we don't know what's causing it, we can still treat it effectively. Now, do different cause types get treated differently? Well, sometimes they do. Most idiopathic neuromuscular cases, congenital cases, and degenerative cases are treated relatively similarly, meaning we're always treating the structural component of these scoliosis cases because all the structural components are similar, meaning we're dealing with curvatures and rotations and translations, and by reducing the structure normally leads to a better prognosis. So yes, it does alter it, but no, it doesn't, because we're still trying to reduce the structure. The structure by underlining in the person's scoliosis is by far the most important thing. So when we know the condition type, and we know the causes, and we know the structural thing is the driving force, we combine all these things to try to get us the best possible treatment approach. As scoliosis being a progressive condition, we know treatment is very important, meaning the sooner we do treatment to the time of diagnosis, the better response we're going to get. So we recommend early diagnosis and early treatment. If we diagnose scoliosis early, but we don't treat it, and we let the curves continue to progress and become larger and more severe, even in idiopathic cases where we don't know the cause, then therefore we're exposing the spine to greater risk, and we're exposing the patient to greater risk of possibly needing spinal fusion and surgery, which is a much more risky type of treatment. So early diagnosis and early treatment, if those two things are combined, we can have a very effective treatment model at reducing and managing scoliosis. Even though we don't know exactly what's causing the curve, we can still affect the structural components. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.